Okay, we are going to take a look at Chapter 9 in Essential Science. So these are the muscles, and we have done bones and joints, and now we're going to do muscles. And there are, again, tons of resources on the internet to help you with this. And I have our guest lecturer YouTubes that are designated for this chapter. So make sure that you are using those. Other study strategies are to get the skeleton, the practice skeleton I talked about, and actually use like some Play-Doh or something and make the muscles. You can do various labeling and coloring. You can pull apart a chicken or a turkey and see if you can do some comparative anatomy. Do please make sure that they are deceased if you do that. And even a roast, you can start to see how the or the muscle tissues layer in. There are a variety of dissection videos. I've posted some. There are others. So this is just, again, there are some theory and concepts in this chapter, but it's more about a memorization of a map, all the muscles that are around, and doing enough different things with the content so that you can establish some retention with it. Now, we're going to reinforce this in the classroom. We will like massage a body area and review the structures, but the ABCs of all of this, as you now know, are up to you to figure out how to do this. And study groups are great, whether they're virtual through Zoom or you get together, and it's can get tiresome. It really can, and I don't want to discount that, but not everything is fun when we are learning. And so what you can try to do is make this fun and use some of the study suggestions in the book as well to help you get a chuckle around all of this information. So let's get to screen share and take a look at this chapter. And there we are. So some of the problems that you'll encounter is that there's pretty good agreement on terminology, but it isn't perfect. Most of the issues we have with terminology has to do with attachment terminology. Are we going to call it a proximal attachment and a distal attachment, which is my preferred method? Or is it going to be the old kind of antiquated but tends to stick there with origin and insertion? And then we're going to have a little bit more theory here on muscle structure and function. And then again, we're going to look at the connective tissue myofascial structure of this, just like we did with joints. Then this section here, the individual muscles, this is something you're going to have to work through yourself. And it's helpful to actually use chapter 10 in conjunction with this. So I'll have a separate video on that, on how you do that. Okay. I am going to have told you in class that you might want to start this now, early, at the very beginning. And this is just an ongoing study the whole time you are in class. So here are our objectives and our terminology. and slow down and pay attention to the learning how to learn segment here. So this section right here, terminology, goes into some discussion about how muscles are named and the functional terminology that goes with it. And it also in this box gives you a little bit of an overview of why this is confusing. And you just, you know, kind of sometimes you have to learn more than one word for something. So here's your section summary. And here's the focus on professionalism, which does make this information relevant specifically for massage therapists. And then we get into a structure function idea here, and we'll make a little bit more, we'll spend a little bit more time on the function part in chapter 10. Those two chapters really go together, but this is where we'll learn the names and the general location in this chapter. So muscle itself is an organ, and so an organ has specific types of functions, and you'll want to know the three types of muscle, cellular structure and their function, skeletal, cardiac, and smooth. As you get focused on naming the individual muscles, remember muscle has more than just the location and that it pulls. It also functions as an endocrine organ, and very involved in regulation through the autonomic nervous system. So here at a cellular level are the functional characteristics of muscle, and each quality here is going to influence how it can function the way it functions. So the excitability means that through a neurochemical event, it is stimulated to contract, shorten. Those two right there are what allows it to pull. And there's enough extensibility to it in the fiber configuration, how the fibers are put together, as well as a neurochemical response to break the bonds between the actin and myosin so that it can let go of the contraction and move out into its resting length. So a muscle has a name. Like I have a name. My name is Sandy. Now, I'm always Sandy, but I'm also sometimes mom and teacher and grandma and subject matter expert and textbook author and gardener and etc. But I'm always Sandy. So each muscle has a name, like deltoid or sternocleidomastoid or latissimus dorsi. That it's always deltoid or latissimus dorsi or gluteus maximus or gastrocnemius. But what that muscle does throughout our movement, our body function, is just like when I am a grandma or a mom or a teacher. It changes. And every muscle can do these things, every one. Sometimes they are designed so that they're a little better at one activity than another, but these are things that the muscle does. And so it can be a mover, it can control movement, it can stabilize, it can direct the movement, keep it from floating over one direction instead of the other. It can act as a part of the stability function around a joint, and it can be a helper. It can do all of these things. But when a muscle is a mover, that requires different function than when it is a neutralizer, or it is functioning more as stabilization. Okay. And then the actual action of what these do when they are a mover, an antagonist, or a fixator, that the actions have names. So when I am Sandy, I'm always Sandy, and I'm being a teacher, then what I'm going to be primarily doing is dispensing information and guiding the student around what they're doing and answering questions. Whereas when I'm a grandma, I might spend more time running around after a grandbaby, or reading a book, or attending a dance recital or something like that. So that's what these isometric and isotonic actions are about. So isometric is when a muscle shortens, all the fibers shorten, but it doesn't produce any movement. So this is going to show up when something is stabilizing, like a fixator, or the stabilizing or support system here. The tone is going to increase, but it's not actually going to be doing pulling or pushing. The isometric functions are, or isometric contraction occurs. Yes, okay. And I got it. The isotonic movements, or the isotonic actions, are specific when movement is actually occurring. When the fibers pull at each other, the actin crosses over the myosin, something is going to happen. So you'll see something. A tone can increase in an isometric, and you won't see anything happen. But if I can do an action that's isometric, you're going to see something. So I can clench my teeth, and there's no real action there. Or I can open and close my mouth, and those would be more isotonic. So when we are in this idea of isotonic, there's opposing movements that it can either shorten or it can lengthen. And if it shortens, that's concentric action. And if it lengthens or lets go, that's an eccentric action. So this kind of gives you a little visualization of that. Okay, then we have the generalized physical structure of the muscle in this figure, so you're going to want to know these words. And here they are in bullet points here for you. And this is the actual functioning unit of a muscle, sarcomere, and the actin and the myosin filaments. And there's some really good YouTube videos on this. And this is still theory. They still don't positively know that the sliding filament theory is what causes the contraction. And how the connective tissue fiber interface is involved in all this. So the relationship of the actin to the myosin and how far apart they are or how close together they are, and where it's optimal there for what's called a resting length, that's your length tension relationship. And if that gets disturbed, something might not have the range of motion it needs. Or the muscle might not be able to pull enough. Or it might not be able to let go and lengthen out. So there's an optimal range there. You don't want something too tight and you don't want something too long. Now, all of this happens through a neurochemical response. Nervous system at the end of the nerve, called a motor end plate, is going to release chemical, and the chemical is going to cause this. And so it's a sequence. So here's your spinal nerve, and muscle contraction and elongation, the eccentric, concentric, and or isometric, is all through the motor function. It's all about what we are doing, whereas the information that is processed in the central nervous system telling us that we need to do something, that's traveling on the sensory nerve pathway. So there has to be a certain level of excitement before the chemical response will occur and the pulling will start. And we have to have a fuel, ATP, in order to do that. Now, if any of these things aren't kind of lined up, then the contracting and or the letting go aspect of this, the concentric and the eccentric function, it's not going to work very well. And that can often be perceived as fatigue or stiffness or tightness or any of the other muscle skeletal type sensations people experience. So here's a critical thinking activity. Slow down and do this. It's going to reinforce your ability to use a sequential thought process that's very similar to the scientific method. And then we get into the blood supply. Muscle is highly vascularized. There's lots of blood supply. Whereas like cartilage or ligaments, the blood supply is not as much. And then we have particular fibers that either contract quickly but can't last very long, or they are slow. You know, so you stop and think about it. If I'm trying to hold my head up, and there's a natural kind of wobble that goes with that, I don't want fibers that are going to tire out really fast. But if I want to run, like in my legs, then I want something that's going to kick on fast, even though it might tire out quicker. Now, muscle can repair. It's kind of like the nervous system. It can repair, but not, it gave regeneration up in order to have the excitability and the contractibility. So it doesn't necessarily repair very good. So if something is injured in a muscle, it typically will repair with connective tissue. So we can think about individual muscles, but functionally, there are no individual muscles. There are coordinated functions. And we'll learn that there's a bicep and a tricep, but they never act alone. So keep that in mind, that everything acts as a cascade of signaling and function. The way things are shaped can determine its angle of pull and what it's really good at. So like a pennant muscle that looks like a feather, it doesn't pull very far, but it can pull really strong. Whereas parallel, they can pull a long ways, but they can't pull as strong. So each of these shapes also makes a difference, just like us. You know, I'm built fairly box-like, and that helps me. I can use my body weight and get a lot of leverage back and forth with weight transfer, where somebody is more lightly put together, they may not function as well with that. So here's your various shapes. And by looking at the shape, you can kind of tell what they do. We're going to expand on that in a minute here. Now, none of this happens absent of the nervous system and the neurochemicals and the hormones. And a lot of muscle activity is functioned. You have to go back and look at the nervous system chapters. It's operates under a reflex, pre-programmed or learned, so that we don't have to think about stuff. And the one that usually is portrayed is the withdrawal reflex, which is a simple reflex. You step on something, you burn your finger, and goes up, processes in the spinal cord, and then you get a motor activity out quick so that you pull away. But everything starts with a stimulus. So what massage is a stimulus that sends a sensation where the central nervous system has to make a decision about that. And then that decision comes out through the motor nerves, and then the muscle and or organ function kicks in. So massage is a stimulus. That's what we do. So here are the different reflexes that are pre-programmed into our body that make a difference in how massage is processed. And so some of the methodology we use is looking to kind of stimulate these various reflexes to try to get sometimes the tension length relationship or the tone in the muscular system to normalize. So here's your section summary. Make sure you slow down and use that as a reinforcing strategy. And this is a lot to think about now, so make sure you take a brain break and go do something. Okay, so now we're going to look at the connective tissue aspect. You cannot separate muscle from its connective tissue. You can pull some of it around, pull it off, but this permeates all the way down to the cellular function. So if you take a piece of meat and you boil it and boil it and boil it and boil it and boil it, you'll break down the connective tissue structure, and then you can sort of pull more isolated muscle fibers apart. But you better be dead when that happens. So this all functions as a unit together. You can't separate muscle from its fascia and or its connective tissue network. And this is what connects all of the structures of the arm, and how the arm is attached through the back and is coordinated to the opposite leg so we can walk. This is all part of how that structure works together. The MBLEX exam likes to ask questions about the various connective tissue coverings and muscles, so stop and pay attention to that. And here is just some bullet points about how the fascia, and fascia is the sheets, and the connective tissue itself is kind of like the jelly part of stuff, or the fibers, how it contributes to the muscular system. And then there's this whole thing about bios integrity and the myofascial continuity. And you might want to take a look at people like Tom Myers or Robert Schleip. They have talked about this. And that concept really came from Buckminster Fuller way back when. And so we also then have these kind of biomechanical laws that have been around enough and shown themselves to be consistent enough that we can kind of predetermine or anticipate what a muscle action is going to look like and how the innervation is going to take place. So these are the biomechanical properties of this connective tissue and fascia, and it's a lot like plastic. A lot of the same methodology that if somebody was a plastics engineer, plastics handling, or plastics molding, a lot of these same components are involved with that. Now, this figure tells me that we're going to start to get into the idea of attachment terminology and movement in here, and how muscles work in phase or in sequence. So this figure right here is the location of these main myofascial units where they cross over and forces are translated from one place to the other. And so just in general, when you're doing a massage, you might want to stop and put some pressure there, some static holding type pressure, and then maybe have the person move the surrounding joints. That's going to help the slip and slide. These are like little focal areas where a lot of function and dysfunction can occur. So a fascia, in particular, the whole connective tissue system, and fascia in particular, responds to mechanical forces, which is what we do with massage. And it translates these mechanical forces. So massage is a stimulus, but it also can function mechanically because the connective tissues in particular, so stimulus would be the nervous system, but the connective tissue structures themselves are more like plastic, and they respond to the mechanical force. And so, and then everything is connected. So think of these cross points here where I have these same blue dots here, all right? So something's going to happen. There's going to be a mechanical force introduced. I'm going to put my hand on somebody and apply pressure. And then what will happen with that is that it's going to change shape. Where is that figure? Well, we'll find it. Where pressure into here is going to change the whole shape of this, even though the parts stay together. Okay, there's your section summary. And here's your practical application, very similar to what I was explaining now. This happens to be relating to scar tissue. Okay. Go take a break. Play around with some Play-Doh or some silly putty, or get an idea. Wrap some silly putty up in some saran wrap. Mess around with what happens with that. Get a sense of the feel of that. Now this segment is going to get into the individual muscles. Now we just said there's no such thing as an individual muscle function. Everything is connected to everything. Everything is interconnected throughout the body. And so we have to think in functional units. At the same time, the way anatomy of the muscular system has been described is by dissecting these functional units. And this is one of the videos I suggest for you to look at. Video series is videos done by Gil Headley. And he's done an excellent job with dissecting these out in terms of their functional units. And Tom Myers was one of the very first that started to think about the body this way. And as we've had more and more fascial research in the more current years, a lot of what he had speculated, same with Ida Rolf, a lot of what they had speculated has kind of been shown to be accurate, at least for right now. Who knows what science will do in the future. So here's our general picture that you often will see. Nobody looks like this, by the way. All of the superficial fascia has been taken off, so the skin superficial fascia is gone. I sometimes will call that the wetsuit. And these are clearly delineated now, right? You can see the lines and all that. And this is the deep fascia. We don't look like that. But that's what we see. So, and here's the side view. And these schematics are valuable in learning. You can kind of see the direction of the various muscle fibers, which is going to indicate their angle of pull. And certainly you're going to have to be able to literally regurgitate all of these muscle locations, generalized attachment and function. You're just going to have to do that. But there are some things that you can do that makes it a little bit easier and helpful. So if a muscle's fibers are up and down, and they move up and down on the body, then you can have a pretty good idea that those muscles are going to function on the sagittal plane. They're going to produce a lot of movement, and they're going to be flexors and extensors, which, so if it's functioning as a flexor, then it's going to be concentrically acting and shortening and pulling. And if it's functioning as an antagonist, then it's going to be elongating, and that's going to be an eccentric action. Now, if it is a diagonal, a triangle, and this could be with the point in any direction, then it's going to be more functioning on the frontal plane, and it's going to be an abductor and an adductor. And if it is horizontal as opposed to perpendicular, it's going to function primarily on the transverse plane, and it's going to rotate. So if we go back up to this diagram and we look at some muscles through here, do you see how these fibers are going horizontally? So it's going to probably rotate something. And over here, do you see how this is a diagonal, like a triangle here. So it's probably going to adduct or abduct. In this situation, it's an adductor back towards the midline. But if we look at the deltoid here, it's also like a triangle, and that would be your main abductor. So if we look at this calf muscle, this gastrocnemius here, most of these fibers are going up and down. So it's probably going to be a flexor or extensor, or specific terminology for the ankle, which is plantar flexion, dorsiflexion. So same with this one right here, which is a bicep. Its fibers are up and down. So it is going to probably be a flexor, and or on the back, the triceps here, an extensor. So just by looking at the shape, you can determine its action, especially what it does when it is concentrically acting, which is its pulling. So as far as learning this and the memorization that goes with it, by knowing the names of the bones and the bony landmarks, that's going to help. Knowing the general regions of the body, that's going to help. And then you also have some other helps here, like the size of the muscle. So this is how muscles get named, and it's a medical terminology process. And then there is the whole conundrum around attachment terminology. And that was previously discussed. So in this section, though, I've listed all of them because I don't know how you're going to find it. This is going to give you a step-by-step process of how to palpate a muscle. So make sure you spend some time doing that. And then we have the organization of this section. So individual muscles are grouped by body area. And then we have the muscle name, the muscle, what the name means, its action, what happens when it functions concentrically, eccentrically, isometrically, where the attachment's at, the general innervation, what are its synergists, what are its antagonists, and what's the common symptom and tender point area that may be referring that. So obviously we're going to start at the head here. So you're going to have a kind of an atlas drawing. It's going to have most of the muscles on it. And then we're going to get into the individual muscles. These are more of a schematic. And then here's where you're going to have all of these elements. So let's get down to a muscle that has a little bit more movement to it. That would be like maybe in the arm or the leg or something. Get down through here. So you can learn how to function with this chapter. The other thing I want to point out to you, once we get to where we're going to be, is, okay, so here we go. All right. So we're looking at the muscles of the torso here. So here's the general overview. Here is your consolidated atlas type diagram. And you're going to want to spend time staring at this and getting an idea where all of this, how the organization is here. Even though this is not a real dissection, it does a really good job of skin, superficial fascia, deep fascia, functional muscle group, deep fascia. You know, this is compartmentalized, of all the muscles that act together are kind of wrapped together. And then another layer, you get a sense of the depth here. This is more on the back, shows you the relationship of the various vessels. Up here gives you an idea of the diaphragm. All of this here is considered the core, all of it together. So, and then the anterior thorax. Trying again to show the deeper muscles in terms of them being more to the midline. Quadratus, psoas. See, just by virtue of the fiber direction here, this happens to be pelvic floor, you can see that there's a lot of actions around working in the transverse plane and stability factors that go with that as well. Now we get into the individual muscles. So let's look at the features here. Serratus, posterior, superior. And it helps you pronounce that. Serratus. Now see, I said serratus. If I'd looked at this, I would have had a better pronunciation of it. Serratus. Serratus means saw-shaped. Posterior means behind, and superior means above. So this is a saw-shaped structure on the back side of the body somewhere, but it's above something else. So that must mean that there is another muscle that it is located above. And there is a posterior aspect of this muscle. Then you look at the drawings, and this gives you a schematic idea of its attachment, which is along the spinous processes. And then that's your proximal attachment, and then your distal attachment for this is over on the ribs. And this is more on a diagonal, so this is going to pull shorter, kind of. This is because on thorax, this is going to act a little different, but it's going to lift back and forth. So it's going to, in our general thought, we had this set up so that it functioned more on the frontal plane. On the thorax here, it's going to lift these ribs in a bucket shape movement, bucket handle shape movement. So it gives you the concentric action. This is what happens when it pulls. So it elevates the ribs. And then when it's asked to act eccentrically, when it's starting to elongate and control, restrains and controls, it's going to work with the opposite movement here. It's going to control the depression of these ribs. And if it's functioning isometrically, which means there's no movement, but an increase in tone, it's stabilizing the rib cage. Here is the origin, fixed and proximal attachment arises from. And then here is the distal attachment. Gives you a little hint here. It says it's deep, lies underneath another muscle called the rhomboid. Here's your innervation. So it's the intercostal nerves that signal this to contract. It's helped, that's what a synergist is, by the diaphragm and other muscles of inspiration, breathing muscles. Muscles that work in the opposite direction. So if this is lifting, these would be elongating while it's lifting, and then when they switched roles, when this then became concentric, it would pull down, opposite actions. So these are all of the muscles of expiration, including serratus, posterior, inferior, which means below. So if there's a tender point here that might refer pain, it's usually on this one near the insertion. A lot of times they're right in the middle of the muscle in the belly. And if this is going to be problematic, if this is actually referring pain, it's going to feel deep, you know, under the scapula, by the scapula. And because of the relationship of nerves in the area and referral pains, you might even feel something like this in your shoulder. So if this is active in here, it's part of that thing you feel between your shoulder blades. So here is serratus, posterior, inferior. So these are kind of antagonist, agonist to each other. They're a functional pair. So it's going to do just the opposite. Instead of elevating in a concentric action, it's going to depress. And the eccentric action is to control elevation. So these two they're connected. There's a functional lift and pull, inspiration, expiration. And that's, again, part of that functional muscle unit. These are the intercostals. Let's get down to another example. I'm going to get onto a limb. Here's all of your core abdominal structures. And keep going. So I suggest you learn these by body area. And really concentrate on a part. So here, I wanted to show you this. Let me bring the size down so you can see this in relationship. Go up. All right. So when you get to, after you get done with a particular area, so this happens to be where we're at the hand, but starting all the way at the face, then the head and scalp, there are skeletal drawings here for you to draw the muscles on. And don't skip on that. It really makes a difference, all right? So let's get our size back up. Yep. Okay. What do we got here? All right, so this is the deltoid. and it's got a triangular shape. So we would expect that there's at least either some abduction and adduction somewhere. But we also have some up and down. Sometimes a muscle has multiple directions it can pull in. So here is, let's get it back up here so I can read it. Oops. Well, I am just having a little bit of difficulty working with our diagrams here. And so, you know, should you have fallen into this as an issue, don't feel bad. You know, apparently it's a common thing. So there's some more of these pictures to draw stuff on. Well, instead of trying to shortcut, let's just do it this way. So, okay, now we're on the elbow. That's our location. And here's your little atlas. And then here is our individual muscle, biceps brachii. You can make an assumption that this is a flexor or an extensor because it goes up and down. So when we look at this, it's a flexor. There's its concentric action. And its eccentric action is it restrains extension so that it's not, there's a nice smooth transition between the two. Where it's located, and touch. And this is where the attachments, where you really need your bony landmarks. And then it's the roles it plays and the intervention, the nerve innervation, and then your common areas. And then down we go again. And these are pretty much located from surface to deep. Okay, so now we're going to look at the other side of the elbow, and these would all be your, this is your supination and pronation. Now we're going to get to the back side. So biceps brachii, brachialis, any of your elbow flexors are going to be in a functional unit with all of your elbow extensors. So this is tricep, and it goes through and gives you all of that. And then you get to draw it. So this is just something that is going to take time, and you're going to have to reinforce and reinforce and reinforce. Make sure that you are looking at all the videos and that you are coming up with creative ways yourself to do this. So let's let this load as I try to get here. See what we got. Because the last part of the chapter will be, this is the gluteal region. Let me use the index. Kinesiology, biomechanics, chapter 9, muscles. Let's get to the pathology. So this goes through and is going to talk to you about what goes wrong. And a lot of times we want to, when we're assessing, we're more about what's going right. But this is going to give you the general sequence of events that happens if something is going to be dysfunctional in the muscular system. And then it goes through and gives us a general idea of what our interventions will look like. And then what medications are typically used for conditions that are common. And then we get into specific disorders. So we can have something that is very local, like a muscle strain or a bruise, or we can have something that is more global, like a autonomic nervous system problem that is going to affect muscle function in general. So this follows along with all the rest we've done, the name of the condition, a description, and then indications and contraindications. And you know what to do. Here's your summaries. And we get to the critical thinking activity, which is really important. And you want to make sure that you discuss with yourself or with a partner, or maybe we'll do this in class, all of these bullet points. And there's a little bit of direction on, you know, maybe I need to look at an atlas, or how about if I go look at Medline Plus or something like that and find out what's going on. And then we finish up with our chapter questions. So we bumbled our way through that, and it gives you an idea kind of how you bumble through this chapter. And if you do it enough, and you do it over and over enough, and you think about it when you're practicing your massage, what structures am I touching now? What structure am I touching now? What's shortening when this moves, and what's lengthening when this moves? And when it shortens and actually pulls, that's a concentric action. And then when it's slowly letting go and going back, that's an eccentric action. And just use the words over and over and over. But just remember, I'm always Sandy, even though I have different things I can do. So learn the muscle, learn who Sandy is, learn the muscle, and then learn all the different things it can do. But I can't do anything really by myself. I have to have others that help, whether it's Luke or Laura in the office, or some Darcy that's helping. So those are your functional units, and you'll get it. You'll get it with the repetition. You just got to keep at it. All right.